Hypertension by Stephanie Joseph of Indiana State University, Nursing 444, Community Health Nursing, Health Education Project 3. Pretest. What is hypertension? What are the signs and symptoms of hypertension? Who is the most at risk for hypertension? What are some complications of hypertension? And what is a hypertensive crisis? Learning objectives. The learner will be able to define hypertension. The learner will be able to describe how hypertension is developed, as well as describe who is usually diagnosed with hypertension. The learner will also be able to explain how hypertension is diagnosed and the common risk factors for hypertension. They will be able to describe the hypertension treatment options, as well as lifestyle changes that can be made to manage hypertension. What is hypertension? Hypertension is a common condition in which the long-term force of the blood against your artery walls is high enough that it may eventually cause health problems, such as heart disease. High blood pressure is the measurement of the pressure or force of the blood pushing against blood vessel walls. When you have hypertension or high blood pressure, it means that the pressure against the blood vessel walls in your body is consistently too high. High blood pressure is often called the silent killer because you may not be aware of that anything is wrong, but the damage is still occurring within your body. Who's the most commonly affected population when it comes to hypertension? It is said that a greater percentage of men have higher blood pressure than women, roughly about 50% of men compared to 44% of women. Blood pressure is more common in non-Hispanic black adults than there is in non-Hispanic white adults. Non-Hispanic black adults are roughly around 56%, and non-Hispanic Asian adults are around 46%, whereas non-Hispanic white adults are about 48%. Your Hispanic population or Hispanic adults are around 39% affected by hypertension. Hypertension risk factors. There are various things that can contribute to hypertension or high blood pressure. Some that we can control and some that we can't. The main risk factors are if your family member has a history of high blood pressure, cardiovascular disease, or diabetes, if you're of African descent, if you're older than 55, if you're overweight, if you don't get enough exercise, you eat foods high in sodium, if you're a smoker or you use tobacco products, and if you are a heavy drinker, more so if you drink more than 2 drinks in a day for men or more than 1 drink in a day for women. Types of hypertension. There are a couple of different types of hypertension. 1, primary or essential high blood pressure. Causes of this most common type of high blood pressure include age and unhealthy habits like not getting enough exercise. The second is secondary high blood pressure. Causes of this type of high blood pressure include different medical problems, for example, issues with your kidneys or hormonal problems, or sometimes medications that you're taking can also cause secondary high blood pressure. Okay, so let's talk about diagnosing hypertension. High blood pressure usually doesn't cause symptoms. There are some that can arise from hypertension, as pictured in the picture on this slide. However, most of the time, the only way to know if you have high blood pressure is if you get it measured by your provider or doctor. Make sure you know your numbers and you can make the changes to prevent or to help limit the damage that it is causing. Since high blood pressure does not have symptoms, your healthcare provider will need to check your blood pressure with a blood pressure cuff. Providers usually check your blood pressure at every annual checkup or appointment. If you have high blood pressure, readings at 2 appointments or more, your provider may tell you that you have high blood pressure. If you have high blood pressure, your doctor may recommend tests to confirm the diagnosis and check for underlying conditions that can cause hypertension. Ambulatory monitoring may occur, which is 24-hour blood pressure monitoring tests that can confirm the diagnosis of hypertension with a device that is used to test your blood pressure on a regular 24-hour interval. However, that device is not always the most accurate. There are lab tests. Your doctor may recommend a urine test or urinalysis, blood tests, including a cholesterol test. They probably will perform an EKG, or electrocardiogram. This gives you a quick painless test that measures your heart electrical activity, and possibly even as far as the echocardiogram, depending on your signs and symptoms and test results from the other tests. That's usually how hypertension is diagnosed. There are a few different stages of hypertension. Normal blood pressure is considered if your blood pressure is below 120/80. Elevated blood pressure is considered when there is a systolic pressure ranging from 120 to 129 and a diastolic pressure below but not above 80. Elevated blood pressure tends to be worse over time unless steps are taken to control that blood pressure. Elevated blood pressure may also be called pre-hypertension. Stage 1 of hypertension is the systolic blood pressure ranging from 130 to 139 and a diastolic pressure of 80 to 89. Stage 2 is a little bit more severe hypertension. With stage 2, you will see a systolic of 140 or higher and a diastolic of 90 or higher. A hypertensive crisis is a blood pressure measurement that is greater than 180/120, and it is in a medical emergency situation that requires urgent medical care. If you get this result when you take your blood pressure at home, wait 5 minutes and retest. If your blood pressure is still high, contact your provider immediately. If you have chest pain, vision problems, numbness, weakness, difficulty breathing, or any other signs and symptoms of stroke or heart attack, call 911 or your local emergency medical number. Both numbers in the blood pressure reading are important, but after age 50, the systolic reading is even more important. Isolated systolic hypertension is a condition in which the diastolic pressure is greater than 80, but the systolic pressure is higher than 130. This is a common type of high blood pressure among people older than 65. Because blood pressure normally varies during the day, it may increase during a doctor's visit. Your doctor will likely take several blood pressure readings at 3 or more separate appointments before diagnosing you with high blood pressure. The main form of treatment for hypertension is medication, along with some lifestyle changes. There are 4 classes of high blood pressure medication that are considered first line, most effective, and commonly prescribed when starting treatment. Sometimes other medications are coupled with these first line drugs to better control your high blood pressure. Some high blood pressure medication are ACE inhibitors, antagonist receptor blockers, calcium channel blockers, and diuretics. Having hypertension can cause a negative effect on other parts of the body, and not having your blood pressure controlled can lead to stroke, heart attack, peripheral vascular disease, kidney disease or failure, complications during pregnancy, damage to your eyes, and vascular dementia. And let's talk about how we can manage hypertension and keep the blood pressure under control. It's simple. First, start by just simply checking your blood pressure regularly at home with a home blood pressure monitor that can be found at pharmacies or online. Eat healthy foods that are low in salt and fat. Reach and maintain your lowest or your best body weight. Limit alcohol intake to no more than 2 drinks a day per man and 1 per woman. Be more physically active. Get out there, enjoy, get walking, exercise at least 20 to 30 minutes a day. Get moving. Quit smoking and using tobacco products. We all know smoking causes many problems, so just let it go. And lastly, work on controlling your anger and managing your stress. Many people don't realize how much stress plays a part on not only your mental health, but on your physical health. You finally completed the presentation. You've gained some great knowledge. Let's test it. What is hypertension? What are some signs and symptoms of hypertension? Who is the most at risk for hypertension? What are some of the complications of hypertension? And what is a hypertensive crisis? You should be able to answer each and every one of these questions from the information that was provided to you. Thank you for watching this educational information about hypertension. If you have any questions, you can always check with your primary care provider and check out the links that I have provided on this page if you have any questions.